Hello, this is James Lowry at James Lowry Hypnotherapy, where I, with the help of a medical provider, aid adults suffering with immune disorders in relieving the emotional stress surrounding their discomfort and in achieving a better quality of life in as little as one session. Today's frequently asked question is, can chronic pain cause hair loss? Now, before I answer that question, I want to make it abundantly clear that the information I am presenting is not to serve as a substitute for medical advice. My role as a hypnotherapist is to serve as an effective adjunct to those already receiving medical treatment who might need additional care. Can chronic pain cause hair loss? Absolutely, because chronic pain can lead to hormonal imbalances, which can, therefore, lead to certain types of disruptions when it comes to normal hair growth cycles. Chronic pain can also cause poor appetite or dietary restrictions that lead to a deficiency of vitamins necessary for healthy hair growth cycles. Chronic pain can also lead to, and oftentimes does lead to, the use of medication with side effects that can lead to or cause hair loss. All of these things together, or even individually, bring with them certain amounts of emotional stress. And when emotional stress is brought on, it makes pain more apparent. When pain becomes more apparent, it increases or amplifies, bringing on further emotional stress and also bringing in further amounts of these hormonal imbalances, dietary restrictions, poor appetite, and so forth and so forth. It all becomes one vicious cycle that feeds into itself. So, how does one effectively break out of this vicious cycle? Through a branch of science known as psychoneuroimmunology, which studies how the psyche, the mind, one's neurology, and one's nervous and immune systems all interact with and affect one another. At the core of psychoneuroimmunology is looking at where attention is placed, the degree to which attention is gathered and maintained, and the overall emotional quality or flavor of that attention. Mind body therapies such as hypnotherapy aim to therapeutically affect attention in this way so that individuals break out of these vicious cycles and reestablish a healthy communication between their mind and their nervous and immune systems. Now, you might be thinking, but James, I've tried talk therapies before and it didn't work for me. How is this different? Well, most therapies aim to alter or bolster your conscious perception of the problem. But let me ask you something. If you could consciously decide right now not to have the pain, the discomfort, the problem you are experiencing, it would only be reasonable to assume that you would consciously do so, would you not? If you could have consciously decided not to have taken on the pain, the problem, the discomfort, and the maladaptive psycho-emotional responses that surround them, again, it would only be fair to assume that you would have consciously done so by now. So the pain, the problem, and the maladaptive psycho-emotional responses that surround them do not effectively exist in the conscious mind. Rather, they are most predominant in the unconscious part of the mind. So, if you're looking to adopt this kind of therapy in such a way that, with the help of a medical provider, aids you in relieving the emotional stress surrounding your discomfort and in achieving a better quality of life in as little as one session, then give me a call or book a free consultation at James Lowry Hypnotherapy. I'm always happy to help.